My friend, colleague, and rock star clinician, Chelsea Turgeon.
The brain and concussions it's a beautiful system in that it protects you. So it's going to shut you down when you're feeling those symptoms. Just like a shoulder, there's many different injuries. There's many types of concussion. So you want to identify where they fall in that. And there's definitely risk factors for that. What a concussion is it's an energy crisis in the brain. One, it's manageable. And you're going to recover.
It is manageable, right?
Yes, it's manageable. You're going to recover. Do something you're passionate and you'll find success. And then you'll be surrounded by people who positively inspire you too, because they also want the same thing.
What I see through your evaluations is that you're not just, as you said, giving this like very vague concussive protocol. It's a very specific, you're identifying what I call them triggers to people that I'm saying, like, and basically what you're doing is identifying the type of concussion they have.
Welcome to the Dr. J.J. Thomas Podcast.
Hey everybody, welcome to the Dr. J.J. Thomas Podcast. I'm JJ. I'm here today with my friend, colleague, and rock star clinician, Chelsea Turgeon. I always get nervous about your last name.
You got it right. Surgeon with a T, I say. It's a pleasure to be here.
Thanks, Chelsea.
I'm very happy.
So, as a lot of you know who've been following along the way, we have all kinds of experts and guests on our podcast from all over. And today we didn't have to look very far, though. Our expert is Chelsea, one of our very own therapists here. And the topic we're going to talk about is concussions. Chelsea is a concussion specialist here at our facility in Bryn Mawr. And she's humble, so I'll say when I say this, she'll get a little blushy. But
I was going to say I'm blushing.
She is like so incredible at her job. Watching Chelsea work in our office over the last however many years, I mean, it's been on and off for almost 3 years, has been really impressive for me. I've always had a lot of respect for therapists that work with concussive athletes and patients with concussions, but seeing it real time for me has been really eye-opening is probably what I want to, So I wanted to share that with the world. So thank you for coming on for that. A little bit, Chelsea, if you could just tell the crowd a little bit about yourself, specifically a little bit about your journey of what sparked your interest in concussion therapy, and concussion rehab.
Awesome. So growing up as an athlete was always like very interested on the on-field, the triaging and the examination, and was just a, athletic sister. So saw a lot of sports injuries and things like that. So that's kind of what started the journey of being like interested in, sports injuries and concussions, and then had a concussion myself, and then saw like my brother and cousins who underwent different management and treatment. So just was sparked in how the variety and how it was managed and things like that.
Where were you in your athletic career when you had your concussion?
I was younger, like adolescent. I was playing indoor soccer.
Okay.
Yeah, and got knocked into the boards. And then came out, felt funny, but went back in and kind of like dropped then. Like I didn't lose consciousness, but was definitely out of it.
Your body was like, this
totally.
is a no-go.
Yeah, and remember that moment significantly, like in my head of kind of what happened there and how did that get managed.
I can imagine, for those of you that don't know Chelsea, I mean, like a lot of my guests, I don't know them that well, but I know Chelsea pretty well, and I can see you, like knowing Chelsea's one of those athletes and people that is very determined, and like I can just see it's probably one of the first moments in your life where you couldn't, quote, push through something.
Right, absolutely.
I think we see that in a lot of our athletes, right? Like they're like, a lot of our athletes that come to us for different injuries, they're so used to pushing through things. And
like doing that next set and being able to get through that. But, the brain and concussions it's a beautiful system in that it protects you. So it's going to shut you down when you're feeling those symptoms. And then I went to Lynchburg College, and I feel like in my neuro class, I thought I was going to be very much ortho, but during my neuro class and vestibular class, like it really ignited something in me. I think it is similar to how we treat here, but what I was so interested was that the body is a system.
Yeah.
And how it is all related and how it relates to those orthopedic injuries on a neuromuscular system. So then I did my research project actually in concussion.
Oh, I didn't know that.
Yeah. So that was like my final project, did it with my neuro professor, and we just looked at, it was a systematic review of kind of what's out there. Cool. So it's interesting, just like going, all the research now and back then, 11 years ago, there were a lot of gaps. So from 2000 into now, there's like huge advancement in the research and kind of just how the treatment and management is going forward.
I know. I feel like even though I'm not a concussion specialist, I've seen that even in just the small bits that I know. I mean, like when I first started becoming more aware of the impact that a concussion has,
right?
Not just in the immediate, but like I was starting to see athletes who were having ACL injuries. You and I have talked about this a lot, and I think even before the literature started coming out, I started seeing a trend where I'm like, I think post-concussive event potentially puts these athletes at greater risk for higher incidence of lower extremity injuries. So for the non-clinicians watching, like your chances of getting injured even in the legs is potentially higher if you haven't fully recovered from a concussive event.
Absolutely.
And but my original point was just that watching having you come on board and watching you deal with the management of it, as I said earlier, it was eye-opening in the sense that there's so many things you do. So I would love to hear a little bit more about the details, anything you can share with us on how you've seen the management, both the evaluation and management of concussions change over the last 10 to 11 years since you've been practicing.
Yeah, absolutely. So I think kind of what has advanced is just kind of the knowledge that a concussion isn't a homogeneous event. Like just like a shoulder, there's many different injuries.
Yeah.
There's many types of concussions.
Sure.
So there's cognitive fatigue. There's ocular issues with ocular teaming, and that's kind of like how your eyes move. There's a vestibular issues, and that's like your head movements and being able to maintain gaze with head movements and balance. And that's the vestibular system is a big system in that it goes peripherally to the central system. So we're talking a little bit more with concussions centrally, but there can be peripheral issues from hitting your head.
Got it.
And then there's also a mood or anxiety concussion. There's a migraine concussion. There's a cervical concussion. So they're not. They're all interlocked, right?
Sure.
So you can have one or you can have all six, and the management of that is very different. So, and then just like getting people in within those 7 days is a massive predictor of better outcomes.
So cool. Yeah, let's pause on the first concept that you said for a minute, like those 6 types. That's something that you did when you started working here, treating concussions here at our facility that I found really, and in fact, you worked on my own son.
Right.
Worked with my own son. And I think that was, again, one of those moments where I was like, wow, you're so deliberate. I think one of the things I harp in our courses, our Primal Foundations course and all those things, is always like, do everything with intention. And what I see through your evaluations is that you're not just, as you said, giving this like very vague concussive protocol. It's a very specific, you're identifying what I call them triggers to people that I'm saying, like, and basically what you're doing is identifying the type of concussion they have, correct?
Absolutely. Yeah. So you want to identify kind of where they fall in that. And there's definitely risk factors for that. If you're someone who has migraines, motion sickness, you're probably going to go quicker into those types of concussions. So the history is really vital too.
From that, like bringing it back to what I saw you do with my son. My son's a wrestler. You guys have heard me talk about him on here. Both my sons are wrestlers, but the one that Chelsea worked with is he's 17 now. I think he was 15 when you worked with him. he had a pretty significant concussive event. But I think one of the things you picked up was, it was during a wrestling match, and one of the things you picked up was that for him, changing levels was a trigger. And it was so cool to watch how you prescribed the home exercises for him, specific to not just his trigger, but obviously as a wrestler, level changing is like a ginormous part of succeeding in the task. So so a lot of his exercises and home prescription was based on teasing into those triggers in a way that he could succeed in, but also challenge it to the point that it would progress.
Absolutely.
So
and I think, and that's kind of how things have like evolved over time. And, you know, like there was a lot of prescription of just like sit in a dark room and rest. But what a concussion is it's an energy crisis in the brain. So when you get hit in the head, like the neurons stretch and the potassium comes into the extracellular space. And during that time, there's a huge need for ATP and glycolysis. But at the same time, calcium goes in and it constricts, and there's this mismatch in energy. And Dr. Mickey Collins says something cool, but he says like that concussion fights dirty, basically. So anything that you have that's weak in the system, that requires more energy is going to decompensate.
That's brilliant.
If you have migraines or motion sickness, these require more energy, and that's where you're going to decompensate.
It's going to attack it. It's going to hit you where you're already vulnerable.
Absolutely. So
Amazing.
so that energy crisis. So there's no biomarker that says that you have a concussion. There's no like MRI that's going to show, because the cells don't die. They just are in demand for energy, and that energy crisis is what causes it. So with what you were saying and prescription, it's just like you have to find, all right, what system is decompensating, what pathway needs that attention with treatment, and then you got to train it.
And then when you train it, you're basically nourishing it.
Yeah, absolutely.
Right? You're giving healthy input.
Right.
That's another thing, like we talk a lot about in here, but I don't think I don't think everyone's trained to think like that in terms of, in our world at least. But it's like, it's input output. And
exactly.
And so whether we're doing an ankle rehab exercise and we're giving them input to accept challenges in multi-directions, or it's a concussive exercise, right?
Yeah. So, I mean, getting in and seeking treatment by a specialist, like within those 7, days is a great predictor.
And that makes sense to me why, because I think one of the hardest things for athletes is what you and I pegged on earlier when you were a young athlete and you tried to push through and it just your body shut you down.
Absolutely.
And I think I see that emotional side of a lot of our athletes. In fact, I think for many athletes, it prevents them from even seeking treatment. The fact that number one, they don't necessarily understand how we can treat the brain.
Right.
And number two, there's that, I want to call it a decline of confidence in their own body and their own system, because they feel their bodies failed them because they couldn't push through this.
Yeah, and I think some huge points that I wanted to bring to the table is just one, it's manageable and you're going to recover.
It is manageable, right?
Yes, it's manageable. You're going to recover. If you listen to those signs and symptoms, so signs are like loss of consciousness, symptoms are dizziness and fogginess and things like that. If you listen to it and you respect, then you will get better with treatment. Some do resolve. Some kids are resilient, and with coming out of the game, they feel okay. But an interesting statistic is just like every minute that you stay in with an injury, it's like 7 to 8 days added on to your recovery time if you stay in an additional minute. Absolutely.
That's an incredible stat.
And that dizziness is like one of the biggest predictors for longer recovery. So you don't want to stack symptoms. Right. And it's about managing it and not stacking them up. And that's the importance of recovery.
And I think that's good. Like I know I've seen just through our work with high school athletes and other athletes in the community that the awareness of of the importance of taking action with a concussive event has amplified, has ignited.
Absolutely.
But I think for kids to realize that piece of it that you just said, like to empower them, not just kids, but parents, to empower them with the stat of listen, like, don't hide it, because
Right.
if you hide it, it's
gonna
gonna
take
It's gonna
longer.
take so much longer.
Right.
But if you just deal with it, and if you just take yourself out of that game,
Right, and then respect the symptoms, and if you have some symptoms and seek some help, like the rehab is much quicker because your
Yeah.
body, needs that and things like that.
Now, what's your preference on how soon you see someone after a concussive event? I'm sure that varies. Like, all these questions it varies, but
Yeah, it definitely varies. Within the 7 days is probably is best. You can have, it is normal to like get symptoms 24 hours after, 3 to 5 days.
like for them to come on later.
Yes. So
Okay.
that is normal. I don't think people like realize that, oh, well, I didn't have symptoms on the field. I
Right.
had a hit, but 5 days later, now I'm symptomatic.
Like,
so that's
now I have a
something-
headache.
Right.
Is it
right.
really just
and I'm
because
just
I was
a little
on my
foggy and fatigued?
Yeah.
Or like if you have anxiety or some other, you might have more anxiety, and we see that a lot. In the younger population, where that's where it comes on.
Yeah.
So noticing that as parents, that's actually part of the concussion. But going back to the question, probably within the 7 days. Yeah. Yeah.
Awesome.
Yeah.
What would you like to see change? Like, so we've made so much progress in the last 10 years, I think. What
Yeah.
would you like to see improve in the management in both the awareness through the public
Right.
and the management with other clinicians?
Yeah, I think awareness is just realizing that it can be managed.
Yeah.
And there's people and clinicians out there that can help you recover. And the smallest symptom can be addressed if that's what you think in your head, and not to try and cover it up or think like you have to get through it on your own.
Yeah.
There's people out there that can help get through it, just like an ankle sprain.
Yeah.
I think sometimes we think because you can't see the brain, it's hard to understand, but
Yeah, actually, I'd love to touch on that a little, because you said with the different events, and I have the benefit of seeing you with the different types of concussive
Yeah.
events. I have the benefits of seeing your creativity.
Right.
Like, I get the impression that that's part of what you love about
Absolutely. Yeah.
is because if you see Chelsea in here, it's so cool. Every program is very specific to that patient's triggers, as we
Right.
said earlier, or injury, and so you can see that in the ingenuity in her programming with her patients. So if you could come up with a couple examples, like a type of exercise you might do for someone like a visual type concussion.
yeah. So let's talk about like a vestibular issue,
Sure.
and they have trouble with like horizontal gaze stabilization, right?
Okay, so and just say that again
so
for my
horizontal- yep.
patients that are watching.
So gaze stabilization is like maintaining gaze on a target with head movement. So you should have like equal opposite to maintain gaze, and moving it horizontally is, in the side-to-side plane, exactly. So, if I have, let's say, a soccer player, maybe I'm doing side shuffling with a ball, and we're also doing head movements, and then if, say, there's a cognitive component, a cognitive fatigue, then I'm adding in some dual task with
Yeah.
different questions, different demands, math problems, things
Yeah.
like that.
It's so fun
Yeah.
to my ADD
Yeah.
brain loves it. Like, I'm like,
that's-
I don't have a concussion.
Right.
I want to do that
Right.
exercise,
Yeah. It would burn out some of your energy.
I know.
For sure.
It's so true.
Yeah.
That's cool.
Yeah. And so just like addressing all the different systems, and then, the one thing that I really do love about concussion and rehab is also that it's very team approach. So you may need, for the cognitive fatigue and things like that, a speech therapist. For the ocular concussion, an OT
Yeah.
is really important. That's specialized in that. So it's just working as a team to make sure that we're addressing all the parts and nothing's being left.
Speaking of that, what about like other components like nutrition during concussion
absolutely.
rehab
Yeah.
and hydration
Yes.
and sleep?
Yeah.
Anything you can give us about those?
Yeah, I think understanding with sleep, especially if you have a vestibular concussion, but other concussions too, that your sympathetic nervous system is in arousal, so you're in fight or flight, and that's because of the pathways that are being involved with both of those. So
Yeah.
that's why a lot of patients who've had a concussion are like struggling with sleep. So with that, even if that was just a symptom, knowing that we can help with that through the treatment, but also just managing it in a way where you're getting good sleeping habits and you're making sure that you're sleeping through the night and not sleeping all day. Nutritionally, like we said, it was an energy crisis.
Yeah.
So your brain and your body is in demand for more in a time where you're not getting it.
Right.
So those are two huge components too. So, knowing as a clinician that maybe you need to bring somebody else into the table.
Yeah. And then actually that just prompted another thought, even with my own son, who's a wrestler, like he happened to have his concussion right nearing around the time of like states a couple years ago.
Right.
And these wrestlers, he wasn't far off his weight at all,
Right.
like a pound or two. But if you remember, he was actually progressing really well with his concussion therapy and his lack of symptoms, or lack of negative response to the triggers. And so much so that we were like, okay, Chelsea was like, you're ready to go back to practice. And practice went well, but then when he had to start cutting a little bit, and it wasn't a lot, it was literally like a pound. So we just started monitoring it was like a couple days before the event.
Absolutely.
Started monitoring his water a little bit. Might have been the day before, monitoring his water a little bit. And that alone kind of re-peaked his concussive symptoms, right?
Absolutely. He just needed more.
Yeah. Like
heal.
He needed the hydration, right?
Absolutely.
So that's for you clinicians. I mean, look, if you're a therapist and you're not you've not done extra training in concussion, I would not recommend. To me, it's really a specialty. Like that's one of the reasons I asked Chelsea to come work with us, because I was seeing these athletes that needed this, and I knew that they deserve something more than what I could give them. However, recognize whether you're treating someone with concussion or not, recognize if you're treating athletes that are watching their weight management for any reason, whether they're weighing in for wrestling, or if they're MMA, or even Olympic lifters have to be careful with that stuff. So if they're going to be changing their diet and nutrition or hydration levels, it's going to play a big factor in their recovery as well.
Yeah. And
Thanks,
I think
Chelsea.
like during that time with like those athletes and things like that, knowing that like, it's easier, the force that you need is much lower when you still have a concussion to get another concussion. So that's what it is. It's just the force. And that's the same thing with people who have like pre-existing factors. So you could get your head hit the same intensity but if I have some of those weaknesses that are going to decompensate, then you're going to be quicker. So when you're looking at your child, and maybe they're a little motion sick in the back seat and things like that, and then they get hit, and you're like, they didn't get hit that hard,
right?
That they're decompensating, and they need more energy for that system.
That threshold
is much lower.
That threshold of response is much
exactly.
lower, right?
Yep.
Yeah. We've seen that in our athletes a fair amount, right? Yeah. So again, back to that awareness thing, like just for the general public to understand that, I think that would be a huge step.
Absolutely.
Yeah. Let's talk about how this has affected. So as you know, we're cash-based practice, and we're promoting other therapists, clinicians in the world to just, raise their standards for themselves, raise their standards for their patients. And I think within that, I know I've recommended frequently, get a niche. Like I tell therapists, like find something that you're really passionate about it, become the best there is at it, and that's gonna just organically grow your business.
Absolutely.
How has being a concussion specialist grown and I guess supported your business?
I think in a few ways. I think one, a little bit, you've touched on my personality a little bit, but just that drive for excellence or whatever. So you surround yourself with people who you want to learn from. So I, had some insane mentorship at Bryn Mawr Rehab by some amazing clinicians that helped me kind of establish this specialty. And so you just have a team around you. One, when you get a good niche, basically that that you can go to. So that's one that helps you be successful.
Yeah.
But then, if you are passionate about it and continue to grow in the knowledge and all that, then the success is going to come when it comes to like your patients, right? So they want to come to you and you want to get them better in that passion.
I mean, I would say almost like at least a few times a week, patients, or last night I had a young athlete, and his dad was asking, they're from out of town, they're from California, and they were here for a lacrosse tournament. But his dad was like, how do you feel about chiropractors?
Right.
And I'm like, look, I feel the same thing about all professionals,
Right.
whether it's a barber or a chiropractor
Right.
or a physical therapist or whatever, just get the best.
Right.
And like, it's the same. I mean, that's why I said I don't want someone to see me for concussion because I'm not the best in concussion. That's why we have Chelsea. So, but truthfully, I think you hit the nail on the head. Like, therapist, finding a niche, do something you're passionate about.
Do something you're passionate and you'll find success. And then you'll be surrounded by people who positively inspire you too, because they also want the same thing.
Yeah. That's awesome, Chelsea. The last thing I wanted to ask you before we close is, just if you've been concussion trained for 11 years, are there any stories of patient scenarios or stories that stand out in your mind of either being really rewarding, special in some way?
Yeah, I would say when I first started out, I was an exertion therapist. Like I just did the return to sport.
Okay.
So that was incredibly rewarding. I had 2 patients that I thought about. And one was, they were both professional athletes. One was lacrosse, female, and the other was a hockey player. And it was so rewarding just to get them back to the level that when they started, they were so impaired, and then back on to the level of like that nothing happened.
So cool.
Yeah, I would say more recently, one is it's a patient who was in a motor vehicle accident. And she was like a year or 2 out and still had concussion symptoms. And just thought, I'm just going to live with them. And I saw her for a month or 2. And she is pretty much symptom free.
And what were her symptoms? Like, what were her
She
residual?
was car sick. She had some ocular and teaming issues. She had some gaze stabilization things with movement patterns and with working out in the gym. But it just was it was a rewarding patient because it was someone who was quietly suffering almost. And just thought, they're not that bad, or I don't, but there is something you can do for it. And you always can address it.
That's cool that's your story, because that goes back to when I asked you, like, how would you like to see the profession change? And that was what you said, basically, like the awareness that we have more control, we have more ability to make a difference than oftentimes people realize.
Yeah,
and that just proved it.
Yeah, and I think like we can think that with an old knee injury, and we will address it eventually. But why aren't we doing it the same thing?
Yeah,
with the brain, which is
so true.
So the main thing.
This has been awesome, Chelsea.
Yeah, it has.
Thank you so much.
Thank you for having me.
No, we act like we get to sit and do this all the time, but the truth is, I want to have Chelsea on next week because we're all so busy running around here. We barely get the chance to do this. This was really fun.
Yeah.
For those of you listening, if you're a clinician, tune in to the YouTube channel, subscribe so you don't miss anything. I have great guests like Chelsea on all the time, and for those of you that are patients, if you're wondering if you can still recover from an old concussion, or one of your children can, and you have questions, feel free to reach out. You can always DM me, and I'll put you in touch with Chelsea. Or I'll put her Instagram thing in the tag as well. And that's
awesome.
it. Yeah. Thanks again,
thank
Chelsea.
you.
Take care, guys.